The story of aging often begins with our legs. One day you notice the skin looks thinner, a vein stands out a little more, or there's a brown patch near the ankle that wasn't there before. The skin feels drier, more fragile, nails become thick or brittle, sometimes yellowed or ridged. Heels crack and roughen, especially in drier climates or after years of standing. Bruises appear more easily. And then there are little growths. Sometimes they're called barnacles. Barnacles of aging or stuccokeratosis. And I like to call it crustaceans, like the crusts of the skin that cling to shellfish. These changes are common. I see them every day. Over the years, I've examined thousands of legs, usually while checking for skin cancers or suspicious lesions. But the legs themselves always tell a bigger story. They show how skin and circulation age together. And among all these signs, the veins. The veins are some of the most revealing. Small spider veins spread across the surface. Larger veins begin to protrude. When the valves of these veins weaken, blood pools and the veins swell like beaded, rope like varicosities. Sometimes faint brownish stains appear around the ankles first. Many patients think these must be from the sun. I often step in before they even ask and explain. No, no, this isn't sun damage. Often they have already asked their family doctor but haven't had a clear answer. So I point this out to them. These are venous stains, iron pigment left behind when blood seeps out under long term pressure in the dependent parts of the legs. Over time, varicose veins disease can bring other skin changes too. Patches of venous eczema that itch and inflame, hardening of the skin that we have a fancy term for, lipodermatosclerosis. Lipodermatosclerosis. Just a fancy name for hardening of the skin. And in some, ulcers that heal poorly. A few of these chronic sores, a few of these chronic sores and ulcers may even turn out to be skin cancers. These changes may start very subtly and then gradually, but they are the signs of veins under strain and venous circulation that is slowing with age. Most people only start to notice when the appearance changes or when someone close to them points it out. For some, the main concern is how their legs look, but that impact can be profound. I met many patients who feel embarrassed or ashamed, who hide their legs under long trousers or avoid beach because they don't want anyone to see it. That distress is real. The way our legs look can affect confidence, relationships, even freedom to enjoy life. For others, the veins cause symptoms aching, heaviness, swelling, or they show their effect on the skin with pigmentation, eczema, or hardening. That's when they shift from just appearance alone to medical disease, where treatment is important to protect the skin and circulation and prevent complications. In younger adults, varicose veins are often just a local mechanical problem, but in later life, they become part of a bigger picture: blood vessels and vascular aging. The same wear and tear that affects leg veins also affects arteries and veins elsewhere, including those that supply the heart and brain. With age, both veins and arteries lose elasticity and strength and circulation slows. The legs can serve as a window. into the health of our whole vascular system. And yes, that includes the brain, where arterial small disease is a cause of vascular dementia. The venous contribution is still being studied, but the main point is clear. What we see on the surface of the legs reflects deeper processes throughout the blood. So, what should you do if you notice these changes? First, don't panic. Varicose veins and venous stains are common. Venous ulcers are usually benign. They don't mean cancer, and they certainly don't mean you're destined for dementia. But they're worth paying attention to. A few of these ulcers may be skin cancer ulcers. So take simple steps. See your doctor, get a baseline assessment. Daily walking, keeping a healthy weight, controlling blood pressure, not smoking, and managing diabetes all protects your circulation. Compression stockings, what most people hate, not the favorite of everyone, but they can help with discomfort and slow progression. And if you develop persistent swelling, eczema, skin hardening, or sores that won't heal, definitely see your doctor. Your family doctor can advise, and if needed, refer you to a vascular surgeon or a vein specialist, a phlebologist. And if the main issue is appearance, remember this: it is never just cosmetic. If the look of your legs is troubling you, that is reason enough to seek help. Modern treatments are available, from sclerotherapy injections for smaller veins to minimally invasive laser or radiofrequency procedures for larger varicose veins. These treatments are safe and effective, done by the right person, and they can make a real difference both to appearance and to comfort. Either way, you don't need to suffer in silence or hide your legs in shame. After seeing thousands of aging legs, my message is this: these changes are not just cosmetic, they are signs of a circulation that has carried you through life, and there are always things that we can do to help. Caring for your legs is not vanity. Caring for your legs is caring for your circulation and caring for yourself. If this message resonates with you and you'd like to learn more about healthy aging, explore other No Hype Health Talk playlist. You'll find related videos on itchy, aging skin, fragile skin and bruising, aging nails, and the vitamin series. Share your thoughts or experiences in the comments and let others know what helped you most. Together, we can make sense of these everyday changes and age with more comfort, confidence, and clarity.